In this video, we're going to be talking about medications to treat anxiety and depression. These are some of the medications that we'll be talking about today.
The first medication class that we will be discussing is benzodiazepines. Benzodiazepines work by increasing the effects of GABA, a chemical in the brain that reduces cellular activity in the central nervous system. Some of the reasons why benzodiazepines could be prescribed include panic disorder, insomnia, alcohol withdrawal, muscle relaxation, seizure disorder, agitation, amnesia, and it could also be used prior to anesthesia. Continuing on with benzodiazepines, it is important to note that Xanax is a prototype for benzodiazepines. All the other types of benzodiazepines are listed on the screen below in the medications list. Next, we'll be talking about the adverse side effects of benzodiazepines. As we learned, GABA works by reducing cellular activity in the central nervous system, which can lead to CNS depression, which can be seen through sedation, dizziness, and ataxia. Medication can also cause anterograde amnesia. Additionally, rash, blurred vision, nausea and vomiting, drowsiness, confusion, headache, and paradoxical excitation can also occur. Additionally, there could also be a physical dependence, psychological dependence, and a tolerance buildup due to prolonged use of benzodiazepines. As a nurse, it is important to note the antidote, which is listed on the screen. Additionally, we want to teach our patients that they need to gradually taper the dose to discontinue or reduce the dose to reduce risk of withdrawal reactions. Also, for patient education, we want to teach the patient that the benzodiazepines can cause daytime drowsiness. So if they do feel drowsy, we want to teach them to avoid driving or participating in any activities that require high alertness. Additionally, you want to also teach them to avoid using alcohol or other CNS depressants, including opioids, as it can lead to increased CNS depression.
The prototype for non-benzodiazepines is buspirone or Buspar. The mechanism of action is that it binds to serotonin and dopamine receptors in the brain and increases norepinephrine metabolism. It is used for anxiety disorders such as generalized anxiety disorder. Some adverse reactions of this medication are paradoxical effects such as insomnia, anxiety, and restlessness, and then GI upset, headache, dizziness, and lightheadedness. Some nursing implications for this medication is to monitor for paradoxical effects and to take precautions to prevent falls in case dizziness occurs, and you want to be especially careful of this in older patients. For patient education, you want patients to report any occurrences of paradoxical GI or CNS effects. If nausea occurs, teach the patient to take it with food, and teach the patient to move positions slowly to prevent lightheadedness and dizziness.
Serotonin norepinephrine reuptake inhibitors, also known as SNRIs, treat major depression, generalized anxiety disorder, and social anxiety disorder by blocking the neural reuptake of these in the brain, which ultimately reduces depression symptoms. Some side effects of this drug most commonly is nausea, vomiting, anorexia, headache, hypertension, insomnia, and nervousness. In older adults and adults on diuretics, you want to monitor for hyponatremia. Some education for the patient is to take the drug with food. To avoid GI upset, acetaminophen can help reduce headaches. Schedule the doses for the morning. Do not stop the drug abruptly because this can cause withdrawal symptoms, and report any increase in suicidal ideations and depression symptoms. Nursing implications, you want to monitor these patients for increased suicidal ideation. Caution in using this drug in patients with kidney, liver disease, glaucoma, cardiac disorders, or hypertension.
The next medication class that we will be discussing is SSRIs, otherwise known as selective serotonin reuptake inhibitors. This medication works by inhibiting the reuptake of serotonin at the presynaptic membrane, leading to increased serotonin in the synapse. Some reasons as to why this medication may be prescribed include depression, anxiety disorders, bulimia nervosa, premenstrual dysphoric disorder, and bipolar disorder. The prototype for SSRIs is Prozac, and the other types of SSRIs are listed below on the screen. Now, moving on to adverse reactions of SSRIs, we're going to talk about Some of the most common ones is nausea, GI disturbances, restlessness, jitteriness, insomnia, sexual dysfunction, grinding of the teeth, and serotonin syndrome. As a nurse, we want to assess our patient for thoughts of suicide or any self-harm. We also want to assess them for serotonin syndrome, which signs and symptoms of serotonin syndrome include mental confusion, anxiety, agitation, tremors, hyperreflexia, incoordination, abdominal pain, diarrhea, fever, and increased sweating. For patient education, we want to teach our patients the medication takes time to work. It takes usually around a month to 6 weeks, so we want to tell them to be patient and continue taking the medication because results will not be, it will not happen right away. We also want to teach them to taper the dose of the medication to discontinue. We also want to teach them to avoid MAOIs, certain opioids, over-the-counter cold medication, alcohol, migraine medications, the ones ending in triptans, and St. John warts.
Monoamine oxidase inhibitors, or known as MAOIs, are drugs that are usually used to treat depression, especially in patients who haven't responded to other antidepressants. These drugs work by inhibiting monoamine oxidase, which is responsible for breaking down serotonin, dopamine, and norepinephrine neurotransmitters. By blocking these enzymes, the levels of mood-regulated chemicals are increased, which help improve symptoms of depression and anxiety. While MAOIs are effective, they can have serious side effects such as hypertensive crisis, serotonin syndrome, orthostatic hypertension, dry mouth, blurred vision, constipation, and urinary retention. While the patient is taking the medication, it is important to educate them about dietary restrictions, such as the patient should avoid tyramine. These foods include aged cheese, smoked meats, soy products, and certain wines and beers because it can cause hypertensive crisis. It is important to educate the patient about the signs and symptoms of serotonin syndrome, which can be known as agitation, tremors, fever, and muscle rigidity. If they experience any of these, they should seek medical attention immediately. The patient should also learn that they need to adhere to the medication because it can take 2 to 3 weeks for it to work. As a nurse, it is your responsibility to monitor the patient's blood pressure, especially after meals, educate the patient about dietary restrictions, recognize the signs and symptoms of serotonin syndrome, and support adherence, encouraging regular follow-ups to the patient's mental health. Atypical antidepressants are a diverse class of medications used to treat depression. These drugs are called atypical because they don't fit into the major classes of antidepressants, such as SSRIs, SNRIs, and MAOIs. Instead, they work in unique ways to help balance the chemicals in the brain to help regulate mood. However, today we're mainly going to be focusing on the prototype bupropion or Wellbutrin, which is primarily used for depression, but can also be used for smoking cessation. It works by increasing levels of dopamine and norepinephrine, which can help improve mood and energy levels. While atypical antidepressants are often effective, they can have some side effects, including insomnia, dry mouth, tremors, increased sweating, and seizures. When the patient is taking this medication, it is important to teach them about the potential side effects that we just stated. It's also important to teach them that it's important to adhere to the medication because the onset can take 2 to 4 weeks to show full effects. And during this time, the patient should also be educated to avoid alcohol use. As a nurse, it is important to monitor the patient for any of these side effects, encourage adherence, and then monitor the patient's mood, such as for suicidal ideation, and then to promote follow-up care to assess the effectiveness of the medication.
The next kind of antidepressants we are going to go over are tricyclic antidepressants, also known as TCAs. The prototype is amitriptyline, also known as Elavil. There are some other ones such as nortriptyline, doxepin, imipramine, amoxapine, and trimipramine. Their mechanism of action are that they exert their effects by modulating around 5 distinct neurotransmitter pathways. These medications function by inhibiting serotonin, norepinephrine reuptake within the presynaptic terminals, rustling and elevated concentrations of these neurotransmitters within the synaptic cleft. Some indications that we would use TCAs are depression, anxiety disorders, neuropathic pain, fibromyalgia, insomnia, and bipolar disorder. When a patient is taking tricyclic antidepressants, or TCAs as we know them, we need to be mindful that they block certain receptors, which is what can cause side effects. So some receptors that they block are cholinergic receptors, and the side effects to that is dry mouth, blurred vision, constipation, and urinary retention. They also block histamine receptors, which is for sedation and weight gain, and they also block alpha-1 noradrenergic receptors, which is what can cause orthostatic hypotension. Some side effects to look out for are cardiac dysrhythmias, which you would be able to know if you've got an EKG. They are contradicted for patients with CAD or coronary artery disease. A suicide assessment is important as these medications can lead to a lethal overdose. Other side effects are sedation, anticholinergic effects, orthostatic hypotension, increased appetite, excessive sweating, and decreased seizure threshold. Client education you want to include is to change positions slowly to minimize dizziness from orthostatic hypotension and to minimize anticholinergic effects. Chew sugarless gum, eat foods high in fiber, and increase fluid intake to 2 to 3 liters a day from food and beverage sources.